Doctors are busy. A normal consultation with a patient takes about 10 minutes in a busy clinic. During these 10 minutes, doctors need to interact with patients, examine patients' symptoms, and make diagnoses. If doctors need to prescribe medication, a lot of factors need to be considered, including patients' demographics, past disease history, lab test results, as well as possible side effects of medication. From time to time, the medication prescribed is not the optimal decision. How to make the best decision in 10 minutes pose a big challenge to clinicians. We proudly present to you our solution, personalized patient treatment, a clinical decision support system that represents the future of healthcare. Imagine a patient comes in for consultation, and this is what the doctors see on the screen. With one glance at the screen, doctors would know various information about the patient, including demographics, past disease history, measurements, and lab test results. After interacting with the patient, doctors can then move on to input other clinically important diagnoses and measurements in the box. Our predictive model will be able to calculate the drug effectiveness score for different medication. The length of the bar at the bottom of this dashboard indicates the probability that each medication is effective to this particular patient segment. The medication with the highest probability is recommended. The next dashboard can help doctors to communicate with patients about possible side effects of medication. Instead of explaining to patients verbally, doctors have the option to show the patient screen. This communication method is time efficient. Moreover, doctors can select a particular patient segment based on various attributes. Only side effects for that particular segment is shown. The result presented is more targeted. Lastly, doctors can also visualize the treatment outcome for different patient segments. There are many criteria to define a patient segment. Some clinicians may be more focused on age, while others are interested in ethnicity. Each node on this graph represents a criteria for segmentation. What the graph represents is, for an Indian patient who is 50 to 70 years old, the effective rate of medication called MTX is 88.9%. The first thing you can do is to compare the effectiveness of different medication. As mentioned before, the effective rate of MTX is 88.9%, while the effective rate of other drugs is 56.5%. One can simply compare the effective rate of different medication by comparing the relative width of the two paths and come to the conclusion that MTX is more effective for this particular patient segment. Most importantly, clinicians can change the criteria to define their own patient segment. Now we can change the criteria from age to gender, and the patient segment we are investigating changes from Indian patient who is between 50 to 70 years old to Indian female patient. Similar analysis can now be done for different patient segments. Therefore, this dashboard has the potential to explore, discover, and analyze different patient groups. The dashboard we just presented is enabled by this solution architecture. Data are firstly extracted from operational database of hospital and electronic medical records of individual department. Data in operational database is generated from day-to-day hospital operation, including patient appointment, lab tests, and pharmacy. These data are structured and ready to analyze. Electronic medical records, on the other hand, contain both structured and unstructured data, Several insightful patient information is only stored in a section called Doctor's Notes, which is in unstructured text form. IBM Watson Content Analytics tool provides customized annotators to discover and extract this information from doctor's notes and turn them into structured data for analysis. Similarity analysis can then be applied on structured data. The result of our analysis is then presented in dashboard for visualization.